What if we already knew what is happening in the brain in autism, ADHD, dyslexia, and other neurodevelopmental disorders? And what if there already was a system to change it? Welcome to another episode of the Neurotrition Podcast. I'm your host, Dr. Z, and we're going to be talking about that system called Melillo Method. Joining us to explain that system is no other than Robert Melillo, who is the leading researcher when it comes to strategies to treat these disorders. He's a functional neurologist, a neuroscientist who has published dozens of peer-reviewed papers, a best-selling author that includes the multi-edition Disconnected Kids that has been published in nearly a dozen languages, a PhD, my mentor, and also who I blame when my wife gets upset when I have to buy another piece of expensive equipment. The Neurotrition Podcast is sponsored by North Florida Spine and Wellness and produced by Juming Delmas Studios. Dr. Melillo, I am honored to have you on the show, and thank you so much for joining us.
Oh, Matt, it's so great to be here. I loved the opening introduction, and again, I'm so proud because I feel like a proud father watching your journey as a clinician and a doctor and as a father. And it's been such a wonderful thing, and I'm so glad you're out there getting your voice into the conversation. We need more people like you doing that. So I'm really glad to be here. Thank you.
Well, it's become more than just a job or a profession for me. It's been a labor of love, and I didn't. Let's talk about this. I was going to talk about this later in the show, but I didn't necessarily set off to do this. And it's amazing how life puts you in certain directions out of circumstance, and I was just very blessed to run into you and your work. And I guess I want to start off the show by, Melillo Method is obviously a treatment we use in our office, and we have talked about it on previous episodes. But for a lot of the people listening, this probably is the first time they're hearing about Melillo Method. How would you explain to those folks exactly what it is?
Well, first of all, I totally relate to your feelings about how, in the beginning of your journey, you didn't see this part of your journey, and neither did I. And the fact is, nobody does. And even when you first become a parent, in most cases, you don't see this as your journey until it's thrust upon you and you have this diagnosis and you have these issues. And now you have certain choices to make, right? A lot of people make the choice of, all right, well, they're told just accept these issues. There's nothing to do, and this is your life. And they sit back and say, okay, that's it. Other people look at it and say, no, I'm not going to accept that, and I'm going to do everything I can to try to help my child. I love my child, I love them, but I don't believe this is the best version of them right now, and I think there's another version out there. Doesn't mean I'm trying to change them, right? So that's where it started for me as well, too. But I had the advantage that I already had, a degree in, chiropractic and healthcare, and I was already teaching clinical neurology, and I already had a diplomate in neurology and rehabilitation. So I had, some knowledge. I was already doing research onto the brain. And so it really, for me, came down to understanding that question. That was the first question that popped up into me the first time any of my kids got a diagnosis was, what is it? What is happening in the brain? And nobody can answer me that. Like no other doctor, no other therapist could give me an answer. And, but they were very quick to say, well, there's nothing you can do about it anyway. So the Melillo Method is my, 35 plus year journey to try to help my own kids, and then to, subsequently helped, tens of thousands, if not hundreds of thousands of other kids around the world. And it's a clinical model that is geared towards what is happening in the brain, understanding that and addressing that, and understanding that there is no damage, there's no pathology, there's no injury, there's no defect. There's no genetic mutation, really, most of the time. There's no, metabolic disease. Most of the kids that I work with are raised in incredible families like yours, and there's no psychological trauma per se.
Right.
And so, it's about, what is the actual issue? How do we change it? And every child is different, so every treatment program has to be individualized, but the underlying core root problem is the same. And that has been my search. What is the root cause? What is the root problem? Because right from the beginning, the reason why I asked that question was because I wanted to try to help, but without knowing what it is, how could I try to help it? And
Right.
so I get these people that come to me from all over the world that, are undergoing some treatment, and it's usually not very effective. And the first thing I ask them is, anybody explain to you what's actually happening in your child's brain? And they always say no. So the answer is, what's your chance of helping something when you don't know what it is? And most people out there that are practitioners have really, to this day, no clue. And that's my mission, as you know, teaching and getting it out there. But the Melillo Method is a clinical program that has evolved over 30 plus years to comprehensively help improve or to help create the proper type of balance and connectivity in the brain and deal with any issues that may be in the body, and do it in a totally comprehensive way, but also in a individualized way to try to, address the core root problem and allow that individual to become the best version of themselves.
Yeah, and I would, to your point, I mean, that was exactly what happened with me. I mean, even before I read the book Disconnected Kids, that really was the first time that I really started to understand what was going on in my son's brain. And, that was a huge frustration point where, he gets his, he regressed, and by the time we got a diagnosis, I kind of knew what that diagnosis was going to be at that point. But then as I start going over, okay, here's what you're going to do. You're going to do, maybe some occupational therapy. You're going to do some speech therapy. You're going to do, maybe some ABA. And this is what we do for this. But through all those conversations, what was so frustrating to me was that no one was really explaining these treatments in the context of how we were going to improve him. If anything, I felt it was how we were going to help him cope with his deficiencies. And that didn't make sense to me because what I knew about autism at that point, I mean, I was already doing a little bit of functional medicine at that point. So I had treated some kids on the spectrum, and, we did the, what the typical things are. We did the gut stuff and maybe a little detox, and some of those kids would show some improvement. But what I always found was that even when we got improvement, it would improve for a while, and then it would kind of go back, and I just kind of felt like I was fighting the same battle over and over and over again. And, if you take the gut in particular, if I get, an adult, a neurotypical adult with, IBS or something like that, I could treat that and pretty much resolve it. But with these kids, that wasn't happening. So I knew I was missing some sort of link with this, because I knew that, like you said, when we do MRIs on the brain, well, I did an MRI on my son's brain. Structurally, it looked like every other kid's brain. So as I was digging more into it, it's like, hey, so this is just how the brain is wired or not wired in certain areas. And so to me, there had to be something to change that. Because I knew, his brain, he was 2.5, maybe close to 3 when he got diagnosed. And it was like, what do we do to actually change that wiring? Because I know it can happen. I just need to know how that actually happens. And that was, again, when I read your book, I was like, man, this is the way. Makes so much sense. And somewhat, I think it's underrated how therapeutic it is for parents to understand that. And that's been a mission even when I talk to parents, like knowing why they can't stop moving, knowing why they can't regulate their emotions, or knowing those types of things that you describe in that has been so valuable, not just for my family, but all the other families that we've run into and shown them this method.
Yeah, I totally agree with you. The typical narrative out there is, this is autism. There's nothing you can really do about it except manage the symptoms and the behaviors as best as possible, and just, accept it, learn to live with it, and that's it. And, that's it. And we, with no really clear answers whatsoever. And that is the general narrative, and it's completely wrong. And it's wrong because the people saying that have no idea what the actual problem is. They don't know what's actually happening in the brain. And so it's really just because really what they're saying is, I don't know what the problem is. I don't know how to help your child. So you have to learn how to accept it, or there is nothing that can be done. Meaning what they're really saying is, I can't do anything, right? That doesn't mean there isn't something that can be done. And that's where, for me, it always came down to really understanding the neuroscience. So for me, this journey has been about understanding the brain. It's also, you're dealing with ultimately an integrated system. And we live in a world where medicine of all types is so highly specialized. They only see their one area. And they don't realize that everything is integrated, right? So that, understanding that it really starts, especially with the brain. What integrates it all? What integrates every system in the body? Where does it all come together? In the brain and the nervous system. That's where it comes together. And so therefore, you can have somebody with an individual issue like IBS, or you can have somebody with an individual issue somewhere, problem. But then you can have the same problem as part of a whole thing, and you look at it and say, well, that is just one part of the problem, because the real problem is in the brain and its the way it regulates these systems. And that's what you see in autism and most neurobehavioral disorders. And that's also what's partly so confusing, because most practitioners don't think in an integrated way. They don't know the brain and how it actually controls everything. And they look at this and go, oh my God, there's so many issues here. How do I deal with it? It's overwhelming. I can't. So, you can't do anything about it. Just accept it. And that's kind of the approach. But when you really start breaking it down and just say there's one problem, it's not 100 different problems. It's one problem in the brain. It's a root issue, and it is responsible for every symptom that your child says. It becomes a little bit more overwhelming, and you're like, okay, all right, so how do we deal with that one problem? And that's what we do and what you do every day.
Yeah, I mean, absolutely. And, you're going more into your point, and obviously, if we're treating a child with ADHD or dyslexia, all of these, kind of things can change. But if we take autism as an example, what, we talk about, it's really about understanding what's happening in the brain. Can you kind of go through kind of a gross overview what is happening in the brain?
Sure. Well, the way I usually start with parents like you when I met with you and your wife was to let you understand that your child's a genius, right? So we're thinking and you're told from the beginning, oh my God, this is, there's something wrong, there's something bad. You feel that way as parents, you feel I did something wrong or, whatever. And you don't realize that it really starts with a gift that, kids on the spectrum, especially the ones that are non-speaking, they are unbelievably brilliant with their left brain. Every single one of them, beyond brilliant, to the point where it's almost impossible for people to believe that they could know that. Recently I got a comment, on one of my posts about this child that, started using a letterboard and things that came out of him about, amazing things. And right away, the response is, how would he know that? There's no way a child would know that. It's impossible. It's not. They know it, right? They learn it. And so it starts with that gift. But it's really this developmental functional imbalance that really has more to do to alterations in normal maturity steps in the brain. That there are areas of the brain that remain in an immature state, and there are other areas that are more mature. So there's this maturity imbalance that creates a difference in the way that the networks in the brain are growing and developing. There's normally a very delicate balance in the brain. And we know that what makes the brain most unique is this asymmetry between the right and left brain. The most differences, every brain on the planet today and every brain since the beginning of time, and we've written a paper where some of the research, we've looked at the research that goes back 500 million years, and the beginning brains we know were asymmetric, meaning they were lateralized. There was a right and left side. But as you go up the animal kingdom, the more different the right and left side are, the more intelligent the animal is. And we have obviously the most asymmetric brain, but it doesn't start out that way. It has to grow that way, and it takes years for it to fully mature that way. We also know, as we talk about that, we also have the biggest brain per body size, but because we're bipedal, we have the smallest birth canal. So most of our brain, 75-80% of it, grows outside the womb. So these stages of development are critically important in humans, where almost every other animal, their brain is fully formed in the womb. And so they come out and, they're almost at an adult level right away. Humans, it's going to take, at least a year or two before we're even close to that, but really 3 years before we're at even 90% of an adult level brain. So there are these sequences where the right brain develops first in the first 3 years, and then the left brain. And that sequence is unique, and that is what leads to the differences of the right and left brain. And if something disrupts that sequence, either in the womb, during the birth process, or outside the womb, especially in the first year, but really in the first 6 years, it throws off this balance that's developing, this dynamic balance. And, there's this excitation and inhibition imbalance in the brain where, we're exciting and inhibiting at the same time. And there's this communication going on. And what happens is that imbalance can be disrupted where one side becomes too excited and it inhibits the other side. And now this side, certain networks are overactive. And the other side, it stops the development. And in autism, it's that left side of the brain comes online too early, and it then shuts down or even crashes the right brain, and then it stays that way. And so we see overactivity of the left brain, which creates things like stims or tics or hyperactivity or OCD or anger outbursts or chronic inflammation. But it also gives them early left brain skills where they may be able to read, at 1 year of age, or they're obsessed with numbers and letters at an early age, or they have photographic memory, so they actually remember and understand almost everything said around them. So that's how they can know a lot of this stuff. And their ability to maybe do math or calendar, all these savant level skills that have been documented are there, and they're left brain skills, but it causes their right brain not to develop. And so therefore their nonverbal communication, their connection most importantly to their body, feeling their body, connecting their body, developing these maps of their body in their brain, sensory and motor wise, they don't have control of their body. And this also can often lead to why they can't speak, even though all the words are there. And because of that, it also creates this imbalance in the sympathetic and parasympathetic nervous system. And this then disrupts all of their systems of their body, the gut, the immune, the hormones, the detox system. All of that is secondary to this imbalance where these individuals are perpetually in this fight or flight, sympathetically dominant state. And so, what we need to do is identify which networks are out of balance. We need to go back and see what is leading to this, which is usually these retained primitive reflexes. We need to get rid of what's blocking the development of their brain. We need to create balance and communication in the brain. We need to address the inflammation and all of those things. But understanding that, most people hear, as you talked about, that, it starts in the gut and it starts with inflammation. It doesn't start in the gut. It doesn't start with inflammation. But that doesn't mean those are not important things to deal with. So that really is the root cause, is this imbalance in networks. All of the symptoms live in this right and left network imbalance. And that is because of this developmental delay in the brain, in the brainstem. So it starts from the bottom up. And that's where we need to start working with it.
Yeah, and to your point, I think you touched on something that's super underrated, is how the nervous system in the brain controls all of these other physiological responses, gut function, immune function, inflammatory stress, detoxification, that we see in these kids. And when you start making that was the connection I started making, like, oh, this is why these kids never stabilize, is because from the brain, top down, is telling, essentially giving faulty information to all of your endocrine system and your GI system and all of these things that's creating this imbalance. And that's been another unexpected evolution in my practice is, as I continue to do a lot of functional medicine with adults, for instance, but I really, as the more I started doing your work with kids, I started realizing that part of these people's problem is that they're imbalanced too, and it probably started developmentally. They may not have any formal diagnosis like ADHD or whatever, but they're anxious, they're depressed, they have all of these other symptoms, and then you start looking at their nervous system, start evaluating it, and it's all out of balance. And starting to layer that, taking some of these same principles, balancing the left and right brain, has made a huge difference to even how I see adults respond in their care and dealing with some of more of their chronic issues. And that's really been an amazing thing. And I think when we talk about functional providers in general, it's not something that's much talked about. But recently I've spoken at a few conferences with functional medicine doctors and introducing this. You can see the light bulbs going off in their head. They've just never really considered it. And it's exciting to see that as we get this information more out to these providers, that I think really there is a bunch of momentum rolling into how this is so important. And what I'm curious, one thing that I know has changed, and especially probably dramatically since COVID, not that I want to rehash all the stuff that went during COVID, but how much do you think, we have raising autism rates, and there's a variety of reasons for that, obviously. But what I'm noticing is, I know you've noticed, is that this rise in more severe autism. Kids that are not necessarily just socially awkward and probably going to go to MIT, but these kids who parents are looking at a very young age, like, this kid's probably gonna live with me the rest of their life. They're not gonna be independent. But at the same time, we've had, COVID, where we had, masks covering, faces that, I think really impeded with nonverbal communication for a lot of these young kids that, as we know, nonverbal communication has to come before verbal communication, right? And that, and technology, and I don't know if you've seen some of these smart bassinets that, basically put kids in a straitjacket while they sleep. How much do you think? I know when I first saw that, I had a patient tell me that that's what they were using a few months ago. I didn't even know it existed at that time, and I was like, no, you got to stop that like yesterday. But how much do you think some of these environmental, not necessarily like stuff in our environment like toxins and stuff like that, but how much do you think that the environmental cultural shift of technology and those things have impacted some of this?
Yeah, hugely. I think so. You go back and you say, again, first of all, are we actually seeing this epidemic rise? Meaning, are there actually more kids being diagnosed? And that's a fundamental question, because I get that question a lot. And the answer is yes, absolutely. We know this documented. I can go through the details and the research, but suffice to say that there are clearly many more kids being diagnosed now than there was 10 years ago, 20 years ago, 30 years ago. So again, you have to look and say, okay, well, what has changed? And, what is going on to drive that change? And ultimately, as we talked about, the human brain is in large part a byproduct of its environment. And so if we take away the fact that we're not looking at damage, we're not looking at injury, and we're not looking at genetic mutations the vast majority of the time, we're not looking at abuse, we're not looking at neglect. So what is it? There are other environmental factors, and there are many. And you just think about it. If you were to think about 20 years ago, 30 years ago, what did a child's life look like from the moment they were born, right? And completely different than it is now. Completely different. I mean, kids right from the beginning were outside, playing outside. They were climbing trees and they were interacting with other children. And, there was very little screen time, if any. And so that is a major factor. But what does that affect? It affects movement more than anything else. But there's other factors that we know that, because this has been happening for decades, and it's been a slow, gradual change, right? Meaning 10 years ago, everybody used computers, but not to the degree that we do now in any way. 20 years ago, it was starting to be there, and there was this thing called the internet, but nobody really knew anything about it, right? 30 years ago, there were personal computers, but nobody really had one or knew how to use them. So it's been this gradual thing, and that's why it hasn't been noticed as much. But overall, what it's done, it's made the parents, it's affected their brain and their body and shifted most society towards an inflammatory profile. It's altered their body and their hormones and, the way that their genes are developed and regulated. And it ultimately comes down to the environmental factors. There are many in my book. I wrote the first book on this, as you know, on, what causes autism and what are some of the things we can do to prevent it. And, it really comes down to a lot of different factors like the age of the parents and, the environment and do they have immune markers and, also, are they left brain or right brain dominant and their cognitive style. And so there are many different factors, but all of it affects the expression of the genes that regulate the human brain. And 84 to 85% of the genes that regulate the human brain development are active during brain development. So, and these happen to be the most susceptible genes. But there's a real issue. It's being driven by the environment, technology, lack of movement, stress, diet, some toxins in our environment. All of that is contributing to it. But again, what is it doing? It's altering this growth and development of the brain.
Yeah, that makes a lot of sense. And especially as you say, you got the left brain developing first and the right brain coming on after a few years. And, if you're doing, obviously, if you're getting a lot of sensory input, lack of movement, that's going to make that, that right, I'm sorry, I said that the opposite, of the right brain's developing first, then the left brain comes on. But if you're doing things to activate that left brain much more aggressively in the beginning, then you're more likely to get that imbalance for sure.
Well, Ian McGilchrist's work, which I'm a fan of his, and he does a great job writing about it. All his books are about, speaking as a world-renowned psychiatrist and talking about mental health issues and the rise of them. He talks about how the last few hundred years we've been moving more and more towards a left brain world and a left brain society. And that everything we do, and now children from almost the moment they're born, is that. And part of the problem is there's so much information out there, and a lot of it is wrong because they don't know what the issue are. So, swaddling kids and wrapping them up most of the time during childhood is completely wrong, right? Eliminating gluten and dairy and foods like that, like peanuts, from the moment, from early on, we know is the exact opposite thing that you should be doing. That promotes gluten sensitivity and peanut allergies. And so a lot of the information that's out there is, from the very beginning. And then we're shoving cell phones in the face of these kids, from the time they're 6 months of age or earlier, which promotes the left brain function. Everything drives that left brain function to come online too early now. And, and that is also driven in large part by the way the parents live their life. And so, there's a lot of confluence of things, and it really comes down to understanding what the problem is, how it's caused, and what we need to do to prevent it or reverse it. And we need to get that information out there because we are seeing an epidemic, and it's only getting worse all over the world.
So I'm always, we already started to touch on this a little bit about how, for both of us, our kids kind of directed us in this path to go through this. And you were obviously a little different because, like you said, you had some background in neurology pretty significantly when you started going into this. But how do you even go about, going through? I mean, I'm just always amazed at the amount of work and time and study it must have been to start mapping this out into the system. How did you start? I mean, it's such a massive, complex system, the nervous systems in general. How do you even go about starting to develop a system like this? How did that progress?
It really started out of love, to be honest with you. Love for my kids, but also love for what I do. And, really a very strong drive from the time, I was young to really help other people. And early on, being a parent, a young parent, I knew right from the beginning that this was one of the most important things I could do with my life. And from there, it became really a passion journey, and a journey that was driven by love. And so when you're really on the search for something, it doesn't feel like work. And yeah, it's been a tremendous amount of work. Obviously, my first textbook, when I was first compiling all this information together over the first 10 years and reading thousands of papers and books and trying to figure it all out in my head, that answer, what is actually happening in the brain, and nobody was out there saying anything. I literally sat down for 6 months, and every day I wrote 1,300 pages by hand because I didn't know how to type. And the internet really wasn't even a thing yet. So I had to actually take stacks of papers, thousands of papers. I would go thousands of papers to the library every day, or, I'd take a dozen at a time or a couple of dozen, and I would go through those papers and literally write this book out. But I loved it. I loved every minute of doing it because as I was doing it, I was seeing it. I was seeing the answer. And it was because there was this thing in me. There was this like, what's the answer? What's the answer? And I knew it was there. I just couldn't see it. And it was like, it's like if an image is coming on a screen and you're like, oh, let me see it. Let it get clear. That's what I felt. And so as it got clearer and clearer and clearer, it was like this feeling in me that was like, wow, this feels, I feel like this is really important. And then,
you didn't use Chat GPT to put all this together?
No, I didn't use Chat GPT at the time. And and then from there, once I started taking that, and it was all about not just understanding it, but then how do I change it? And so once I started doing that, and I already had a background again in the brain and really functional neurology. And I was already a clinician. I already been in practice for 10 years, at that point, 20 years. So now I had tools around me that I could pull in. And I knew a lot about diet and nutrition already and vitamins. And so as you start working with it, then the results motivate you. Right from the beginning, right. I started seeing results with kids that nobody was getting. And I remember one of the first non-speaking kid I ever worked with, Daniel, and, his parents came in and started working with him. And they came in one day, the first day they came in crying because they had just come from a psychiatrist that told them, look for an institution for your son. And then, within 3-4 weeks, they came in crying because they were like, Daniel said his first sentence today.
That's so awesome.
And I remember I was in shock, and I remember the whole family was around me, hugging me, and I remember thinking to myself, I have no idea if I had anything to do with this, but if I did, what's more important? This is what I want to figure this out the rest of my life, because there's nothing more important I can do with my life. And really, that's what's driven me. So it's never felt like work, Matt. It's always felt like a gift. And it's always been, really kind of this really interesting, fun journey. And, I feel like my life has had purpose and meaning. And to me, when we talk about when we leave this world, I remember my father when I was young age would say to me, you need to leave a mark in the world. That's what you need to do. And so, I feel like, okay, I am doing that. I'm leaving my mark. I'm honoring my purpose, and I'm giving things more than taking in life. And I never stop. I mean, I'm still fascinated every day. I'm reading every day. I'm taking it and I'm integrating it, and we keep getting better and better and better and better. And that's fun, because this will be until the day I die. I'll keep on doing this.
Yeah, I mean, I can tell you, and that's something I really respect, and a lot of different methods, and not just with what we're treating, but there's all these different doctors who have their branded systems and different things that are out there. But what I've been really impressed with Melillo Method in general is, I think the first course I took with you was 10 years ago when you were doing it in Chicago. And even from then, to see, while the core foundational parts of this has been essentially the same, watching the progression, how as you've done more research and just more experience, how you've evolved this process and just continuing to make it better, I think speaks a lot to that, because there's a lot of stuff out there that, okay, we came up with this original theory and it seemed to work a little bit, didn't actually do any research to validate it, and then they just kind of left it the same and never had the curiosity to continue improving it. And I think that's something that speaks to someone who really truly believes in making this the standard way. I really believe in my soul that this is going to be the standard way we treat kids. And I think that momentum is rolling forward on this, because you don't see that in a lot of even in the other common disciplines, whether it be ABA and speech therapy and occupational therapy. You don't see that progression as much, and how to improve and change these kids' brain. And I don't mean that as a knock. I mean, we work with a lot of occupational therapists, and I have one on staff, and speech therapists who have been valuable for us and helped us with things that we can help our son. But there's nothing ever been quite like this. And I think this is a good segue into going, when I post, about what I do, and I'm, maybe doing a workshop in town or something like that, and we post these things in different autism groups and stuff like that, there's always that one person, or usually that one person is like, well, what's the science behind this? Is this evidence-based? And I actually I get kind of excited when I hear those comments, because I've totally, I gotta be honest with you, I've lost track of how many papers you've published in just the last 3 years, really. Not to mention the amount of research you've published over your career. But I'd love for people to kind of get an understanding of, kind of an overview, what is the research behind this, about what you do?
Well, as you said, a lot of treatment approaches, they come out based on some theory, which really, again, doesn't really understand what the problem is, but they make certain assumptions. And that's okay, because a lot of those things were before a lot of research was available. And so that's the way things were done. But as you said, a lot of people go out there and they'll make claims or have an approach, and they don't do any research. And a lot of the problem with that is because if you do the research, it might prove you're wrong.
Right.
So now here you are saying, hey, this is it. This is the way to go. And then you do the research and it shows, no, that's not the case. Then what do you do, right? I've never been afraid of that, because I've always been in search of the truth. I've been in search of the answer. So I'm not, even though I have, these concepts and obviously that are core to my foundation, it didn't start with that necessarily. I just wanted to know the answer and how to change it. And I don't care what that was. I just want to know what it is. And it just so happens that a lot of my initial ideas and thoughts were proven correct. But, it wasn't about that. It was about the search for the truth. And then obviously you have an obligation, especially if you're coming out with something that is unique and new, that you have an obligation to prove it, right? I mean,
sure.
Okay, you put up or shut up, right? You say that this is going to help. You say that, prove it in really, the highest level peer-reviewed journals in the world. Do these randomized age-matched double-blind study and really prove it. And so that's where my journey has been. In the beginning, it was about understanding what the problem is, being able to come up and really understand the concepts and the theories and build a model of, what's going on, a universal model, meaning that it encompassed everything, every different version of the spectrum and every different symptom, and really explain the differences as well as the similarities, and be able to come up with a program that can address all of that individuality and the core issue all at the same time, and then prove it by actually showing these outcomes, literally doing the experimental data, doing the imaging of the brain before and after, looking at things, measuring cognitive function before and after. So, that's the way science is supposed to be done. That's the way anything, to me, this is the only way you should do it. And people that are out there that are making claims or going on, Instagram and say, hey, use this therapy or use this modality and it's going to change this. And you do this one exercise for anxiety. It's like, that's the stupidest thing in the world. What is anxiety? There's different versions of anxiety. What's happening in the brain? So, for me, a lot of that journey has been about really understanding the neuroscience of the brain. So, and again, I've gotten other degrees. I'm always a student. I'm always learning. I've gone from, my chiropractic degree, and then I got a degree in neuropsychology, rehabilitation. Then I got a PhD in developmental cognitive neuroscience. So you put the work in and then you translate it and you put things to the acid test. So there's an extensive amount of research that I have well over 100 papers that I've published. My research partners have, over 500, 600 papers. So there's an extensive amount, and a lot of it is outcomes data, meaning actual research, looking at before and after. And, the most recent one you said, where all the research papers have come out of in the last 3-4 years, have been this, relatively large randomized age-matched controlled double-blind study looking at retained primitive reflexes in children, adolescents, and adults on the autism spectrum. And that, looking at brain imaging, looking at neuropsychological tests, looking at neurological function before and after. So the research, I think, is pretty extensive. And now, we're in the process, as you know, of really even expanding our centers around the world. And we have developed a software system to collect all of our outcomes data from the parents, as you know, and also even more so from our centers. So we're going to be compiling so much data, outcomes data, which is going to guide us to make us do what we do better, which is the primary, but it's also going to prove beyond a shadow of a doubt that what we're doing gets outcomes that nobody else in the world does.
Yeah. And when you look at, you had a Harvard study that was really cool. You've had studies on, how this therapy has changed the brain waves and how the brain is essentially how the brain is connecting. And I think that's really an amazing point for people to understand is this is not a symptom-based treatment. This is actually changing how the brain wires, how it regulates. And when you do that, that is, it always gives me goosebumps every time I talk about it, because when you're changing how the brain is wiring and regulating itself, you're actually are getting to the root cause of the problem. And that, even if there's not really medications for autism in particular, but even if you did have one that worked really well, those changes and those benefits are going to go away the second you stop the medication, or until the brain finds a way around that kind of patch that the medication might be creating. So the point being is, how damn cool is it to think about that when you do this, you're actually making a long-lasting, and I would say permanent change in how the brain regulates.
Yeah, to me, like you said, what has driven me over these years, and now I've gotten to the point where, I think is the coolest thing in the world, that we can actually look at something like autism, which is probably the single most challenging issue in neuroscience anywhere. I think there's no practitioner or a therapist that wouldn't say that, okay, autism is absolutely the most challenging to understand. That's why I went there, because I knew that all of these were versions of the same thing, but autism is the most challenging. And if you can understand and change that, especially the non-speaking autism, if you can have an impact on that, then you can affect anything. And so, we know, and to be able to do it in a measurable way, and there's a certain, Matt, also as a parent, there's a sacredness to it, meaning that I'm dealing with a parent and this is their child. And this is the most important thing in the world to them, and the level of stress and that comes onto a parent when they get this diagnosis. And I better damn well know what I'm talking about, right? I better not just throw crap out there, and I need to prove it, right? That is my responsibility, because I'm dealing with, parents that are in pain and want to help their children. And so, that is, but when you get now at the realization that, I literally know I understand this better than anybody in the world. I think I understand the way the brain works clinically and functionally and from a neuroscience perspective. And I'm not operating out of ego, right? That's not an ego thing. I'm talking about, I worked very hard at that, and I've been very passionate to it. And, but if you know it and you don't apply it, what does that mean? So yes, to be able to do this, to understand this, I don't think there's a cooler thing in the world that you could look at and say that you understand the root cause, that you're dealing with that. And then, I put together a program that I think addresses that root cause in any of these cases, in any age, more effectively than anything, in reproducible ways. But we're always looking, how can we perfect it? How can we refine it? How can we get better?
Yeah, and I think that leads us to kind of another topic of conversation about, what does the success looks like? I mean, because, to me, it's super impressive to see a functional MRI change and see the brain wire change, or see QEEG changes and see more balance in the brain waves. But I know for a parent, it's, they want to see behavioral changes. They want to see their child being able to make friends, socially engage. They want to see them be able to succeed in school, and maybe even just be able to attend a school. And, for me, I mean, I'm going to be, pretty straightforward that, my greatest success story has definitely been my son. And that's probably a little subjective. There's been some also, really cool results we've seen with a lot of families. But, a child who has gone from nonverbal, severe, I would say pretty severely autistic when you saw him, being able to now, I was just telling you before the show how we're starting to have conversations with him. He can tell us a little bit about his day. He's starting to make friends at school. He's, being able to get up and, get dressed, brush his teeth, do, care for himself. Probably for for us as parents, he's starting to do his chores like his sister, which is a nice step in the right direction as well, to be able to do all of that. And I think it would be cool to kind of go into some of those cool stories, some of the cool things you've seen. But I think we have a video of 10 years ago, the first time you saw him. Can we bring that up real quick?
Yeah, so what we're doing is we're doing an actual physical neurological exam. And this is the thing, especially when we're looking at things like reflexes, we have to physically touch them and see them. We can't do that virtually. And we're looking to see if these reflexes are there. There are reflexes that we're born with that lead us through that early development that need to go away at 1. If they don't go away, they literally stop the brain in development or slow it down. But then they can also lead to these imbalances. So what we see is the Babinski is one of these reflexes that should be gone by 12 months. And it should always, when it is there, it should always be exactly symmetrical. And so what we see is the Babinski, or the toes going back. The actual response we want to see is the plantar response with the toes going down. So what you see is one side, the toes are going back, one side they're going down. That tells us everything. one, the reflex shouldn't be there, I mean the brain is developmentally delayed, and we also see that it's asymmetric, and that it's there on the left foot, which means the right brain is significantly more immature than the left brain. So it tells us everything about, that there is this delay, that these reflexes are there, and that there's an asymmetry, and that the left foot and the right brain is much more delayed than the left brain, and that is, so it's right there in that examination. And then we look at other reflexes that are confirming that.
And the next part of this video is you got real excited because we had just had our daughter, and she was, I think, she would have been 3 months old when we did this. So you got real excited to look at her because these reflexes are supposed to be there, right?
Yeah, they're there for the first year, and they need to be there. If they don't develop on time, that's one of the reasons why they don't go away. So, if a child doesn't meet their milestones from the time that, they're not in the right position in the womb, or they have difficulty getting out of the womb, or they don't latch on, or they don't roll over, or they don't crawl, the reason is because these reflexes aren't there when they're supposed to. And if they don't come on fully in that first year, they don't go away. So, so when you see a baby that is 3 months that has the reflexes fully engaged, I'm like, great, now I know this child is actually developing the way they're supposed to, and that, they're less likely to end up with some sort of developmental imbalance.
And that's super important. And that's, one thing I try to educate parents on. And I got in trouble at a conference I was speaking at because I made the comment that, your average pediatrician is not going to be looking at these primitive reflexes. I mean, I know, at least for my experience, I don't even think I remember our pediatrician touching our son one time. It was just questions about different milestones and how different things were going. I got in trouble because there was one more functional pediatrician who did that on a regular basis in the audience, and she she wasn't real happy with me. But in general, I think that is the case, that a vast majority of pediatricians are not looking at this. And I really believe that we could, before these kids even show, symptoms that are clinical enough to form a diagnosis. Would you agree that this is a great way for parents to get ahead of these things, where they're like, how many times do you see a parent like, I'm not really sure there's a problem. There seems to be something a little bit off, but I don't know if it's just normal. I always say, well, let's check his primitive reflexes, because like you said, if they're there when they're not supposed to be there, or if they're not there when they should be there,
or
that
if
is
they're
already
asymmetric, or if they're asymmetric at any point.
Right. That just shows that there's simply an immaturity in the nervous system. Now, how that plays out into what alphabet soup they might get down the road, that's hard to tell. But it certainly at least directs us that there are some things to do to help catch that maturity up.
You're exactly right. And the fact is, and I have pediatricians that, work with me in my office and and they tell me all the time, we don't know any of this stuff. We don't learn any of it. We never look at primitive. So, if there's one unique pediatrician that does it, good for her.
Right.
That's the way it should be. They used to all do this.
Yes.
They all used to look at. So, but they, their understanding of human brain development is just non-existent. They don't understand the differences of brain development, and it just doesn't exist. And it doesn't mean they're not good people and they're not trying their best or whatever, but there's this lack of knowledge that is there. And so, again, one of the other responsibilities I think you have as a researcher and a clinician when you're doing things is to try to create change. And so, we wrote a paper, that came out last year, that was in a major pediatric journal. And they came to us because they were saying that, hey, all these pediatricians are reaching out to us asking about primitive reflexes. And, and we wanted to know, where is this curiosity coming from all of a sudden? And they realized that it was coming from our papers that you've talked about, that we put out there. And they said, can you write a paper directed towards the basic clinical pediatrician? And, we did. And it was about looking at primitive reflexes as the earliest developmental marker of, neurodevelopmental issues. And the idea was to now make this the new standard again. or make the old standard the new standard again. And so that's one of the ways that we're trying to, hopefully change things and make a difference and trying to get them. But as you said, going out there and teaching and having people like you now go out there and teach this information to other people is the way that we're going to shift it. But ultimately, you shift it by having the outcomes, improving it, and making a difference. But, these simple things. And as you said, I also right now am in talks with one of the largest daycare centers and schools for early childhood in the country. They have over 70 schools, and they want us to work with them to develop early markers, like the earliest markers. Many of these babies start in this daycare at like 6 weeks. And so we want to be able to, put together a way of assessing and noting red flags, and then educating their staff, but more importantly, the parents early on, saying, hey, this is an issue. These are things you can do now to change this, before it becomes a problem. Everybody talks about, early intervention is the key.
Yep.
Who's actually doing early intervention? And even when they do early intervention, I've had so many kids that have been through early intervention treatment at 18 months or even earlier, and it almost never makes much of a difference, because what are you intervening on? You don't know what you're doing. You don't know what you're trying to correct. So your early interventions typically don't really have much impact, but this will have a huge impact.
So do you have a case? I mean, this is probably a really tough question for you because you've helped so many kids, but is there a case or two that really stick out to you? Like what has changed that really sticks out in your brain?
Yeah, well, because I've used this child right now. He's in the forefront of my mind, Wesley, this amazing child and family. And as you know, the ultimate mystery for me was this non-speaking autism, and not only the primary question of what's happening in their brain, but how does it prevent speech? Nobody's ever answered that question. Like, why does a kid like your son, why can't he speak? What is literally preventing them from speaking? And so, I really wanted to understand that. And so a few years ago, started working with practitioners that did spelling, where they could work with letterboard spelling. And it's kind of a crazy thing. And I saw it years ago and I thought, that's not real, because I didn't understand the neuroscience behind it. But then once I could understand that, and I could see it, and you get these kids who can't write at all and can't type and can't speak and can't control their body in any way, and it looks like they don't know anything. It looks like they're not paying attention, like
they do. They know everything you're saying.
Right. It looks like they're not in this world. And then if you do it right, you can get them to type on a letterboard, and what comes out of them is unbelievable. And it varies. Some kids are so dysregulated it may not be a lot. Other kids, they start full sentences. So we had this kid, Wesley, from Tennessee. His parents were amazing. And, 12 years old, very severe autism, never spoke a word in his life, constantly stimming. He would bite himself and other people if he got near him. And so they just would kind of put him in a corner in a room in a school, and that was it, right? They didn't think he was teachable. They didn't want to get bit, all of these things. And so the parents started working with me at home. They started seeing results. But then they came to New York, and they came for 2 weeks, 3 weeks. And it was really remarkable because, again, from the very beginning, the first exam, it was, and you look at your son when he's 2.5 and I'm trying to examine him, that was part of the program. You need to be able to, how do you work with these kids? How do you develop a system that's going to be able to really work with children or adults? Because imagine now a 25-year-old kid that's like that, that's 200 pounds. How do you work with them? How do you get it so that you can actually do therapy with them to change their brain? Developing that part of the system was really critical, being able to understand how to work with parents and use this. And so with Wesley, it was a really violent thing in the beginning. And then, then he went into and started working with the letterboard. And it was absolutely unbelievable. He started, typing in full sentences, and he started talking to his parents about his feelings going back years. And this kid has been this wealth of information, because when we get kids like this, I look at them because I know they're so brilliant. I look at them like, if I had access to Einstein, what questions would I ask him, right?
Right.
If I had access to Isaac Newton. And these kids are like that. They're some of the most brilliant people that have ever walked this planet. And I ask them, why can't you speak? Tell me. And they tell me. And he has told me so much stuff. And he does almost every week I get letters from him and from his mother now. And he's now speaking in some part. But his ability to communicate and his level of knowledge. And we were able to actually recently, he came back for the third time, and we were able to test him. He was able to control his body enough that he could do an academic achievement test. And this was a kid that they didn't think a year and a half ago knew one letter. And now he was able to read on a standardized test at a college level. This is a kid that's 14 years old now, right? And he has just given me so much information. And he talks constantly about the right and left battle between his brain and how that is the root issue. And he even says, I know when I was born, I wasn't autistic. I remember when I became autistic, and that was around 3.
Wow.
He's like, I remember I could do things before that. And first of all, no one should be able to remember that point.
No.
Because his left brain was online, he was already forming memories. And the fact that he knew that this wasn't something he was just born with. This was something that evolved over development in the first 3 years. And then once this imbalance was created, it could not self-correct.
Yeah, I think that speaks into why so many people, kind of a different wormhole in general, but I think that evolution of this also speaks to why so many parents see this sudden regression at a certain point. It's usually, like you've spoke to a lot of times, during these normal shifts that should be happening, going from left brain to right brain development and vice versa, that really describe that very well. So, I know I have no doubt that a lot of families, parents watching this are, definitely have a lot of interest in how to do this. How would you recommend a parent just getting started? Hey, I want to look into, how do I do this? How do I start utilizing some of this with my son? Where would you start?
Well, the first thing, like you did, is read my book, really, Disconnected Kids, to really understand it. And then we have a YouTube channel. And, I've created this 90-minute video recently, which really goes through all of this. And especially in regard to, what is preventing speech. Whether it's a left brain or right brain delay, both of them can affect speech. But how does it also work with the gut and the immune system and, all of these things? So I think gaining information so that you feel comfortable with it. But my website is very active, drrobertmelillo.com. People can go on there. I have a lot of information on there. If they're interested in reaching out and doing a virtual consult or speaking to me or one of my staff, they can, book an appointment and reach out there. There's an info@drrobertmelillo.com. That is the email they can reach me. I'm very active on social media and on Instagram, and I'm always putting information and videos out there. And then we have 2 active centers here in New York, one on Long Island, one in New York City. And I'm always, I'm there, one or the other, usually most days. And then we're going to actually start putting on a series of lectures here in New York City that is going to be informational to parents and kind of give them some hands-on so that they can start looking at some of this stuff themselves. And I think the first one's going to be around February 26th in New York City.
Cool.
So that's something, and we might film it so people can have that out there. But if someone's in the New York metropolitan area, they can reach out and ask about, when is that going to happen and how do I get there? And there will be limited seating. So, the earlier reach out, the better.
Well, that's fantastic information, Doc, and I really appreciate you going so in depth and taking the time for us to go through all this. So that's going to be all for this episode of the Neurotrition Podcast. I really hope this gave families who are struggling with their children, more than a glimmer of hope, just like it has for my family and for my life, to be real honest with you. But there are really lasting changes you can make to the brain, as Dr. And honestly, as I like to steal a phrase that Dr. Melillo uses. It's my favorite phrase he uses. It's all about making these kids the best version of themselves they can be. And if you want to learn more, if you're in Florida too, we do this as well. And please don't forget to like and subscribe and follow us on YouTube, Instagram, TikTok, and Facebook at Neurotrition Podcast. And please drop us a comment on what you thought about the show and the episode. Dr. Milo, I can't thank you enough for joining us. I know you very busy, and I really appreciate taking the time. And everybody, we look forward to seeing you on the next episode of the Neurotrition Podcast.
Thank you, Matt.